Hello, folks. Welcome to another edition of Inside the Marble Palace, Postmedia's look at Saskatchewan politics this week. I am Murray Mandrick, political columnist for the Regina Leader Post. Joining me as usual, Arthur White Crummy, our legislative reporter for Leader Post and Star of Phoenix, and from the Canadian Press, newly arrived at that position, but in the province for a long time, Mickey Djuric. How'd I do on that, buddy?
You nailed my last name. Thank you. And thank you for that kind introduction. And I'm
Really
nervous to be here.
You should be. Mickey's one hell of a reporter. We're just glad to have her. She's been buzzing around other locations in Regina, and we'll now get to see more of her on that. But we're going to start with Arthur real quick. Arthur, I guess the best place to start is always the numbers. And sadly, I saw a number today. Ontario, I think, is 3 days straight under 500. And we can't say that. Isn't that amazing? With a province 14 times our population, how bad is it in terms of the actual numbers out there right now?
Yeah, we've had comparable numbers to Ontario, as you say, a much more populous province for some time now. Luckily, they seem to have somewhat plateaued here in Saskatchewan around the 500 mark on average here for about a week or two now. That being said, of course, we're seeing hospitalizations creep up exactly as expected with that delay that we typically see. And for the first time of the pandemic, they've reached above 300 hospitalizations province-wide. That includes 65 people in the ICU. And the stresses that we've been talking about now for weeks are just getting worse. We've of course heard about canceled organ donations. We've talked about canceled, surgeries that are said to be elective. It's really bad, and there's really no sign that it's going to get better anytime soon in terms of hospitalizations, because we're going to continue to see that effect of the high case rates that we've seen in the previous 2 weeks.
Mickey, this is similar to what's happening in Alberta, and one can argue the Alberta numbers are actually worse right now. In response to that, Jason Kenney, United Party, Conservative Party premier in Alberta, has done, I think, what would best be described as a bit of pride swallowing. There might be political reasons for him doing that, if I may venture, because he's getting pressure from both the NDP left and his own caucus. But he certainly handled it differently. And I think one place where he's probably handled it differently is his relations with the federal government, the federal Liberal government, which I suspect have been as bitter as Scott Moe's relationship with Justin Trudeau and others. But he is actually seriously considering the offers from the feds, and perhaps the need to call in the military at that point. What is happening in Saskatchewan, or I guess maybe I should better put, why isn't Saskatchewan responding in the same way? And what is the request, and what is the back and forth between Ottawa and Saskatchewan right now?
Well, I think similar to Alberta, both provinces are tapping into the private sector when it comes to testing. And also Jason Kenney mentioned yesterday that he was maybe looking at options of communicating basically with hospitals down south in America. Here in Saskatchewan, our health minister, Paul Merriman, has not accepted the type of help that his federal counterpart has offered, which includes staff like nurses, doctors, medicine, respiratory therapists. Both the federal health minister and Prime Minister Justin Trudeau have called the situation in Alberta and Saskatchewan heartbreaking. As Arthur mentioned, we've seen the suspension of organ donations, which will have a ripple effect across Canada. And I think this is why we are seeing the federal government push so much for help, because when I spoke to the federal health minister, Patty Hajdu, she had said that she worries that the cases in Saskatchewan and Alberta are also going to have a ripple effect across Canada, just because we're such a mobile country. People have to travel for work, people have family in other provinces, and they really do worry that the cases that are occurring here could spread throughout other parts of Canada.
What is the federal health minister saying about Merriman's request for more testing and a different approach to the people now in hospital in terms of treatments, because that seems to be the sticking point of this issue. Frankly, I just see there's a lot of squabbling between Ottawa and the province right now, but I honestly don't understand what the dispute is. So my understanding is we have a lot of testing available. My understanding is we have a lot of vaccines available. What is it that Paul Merriman thinks that Paul Merriman needs that can help us right now, and why is he maybe legitimately rejecting what the federal government is offering?
Well, I think that, the Saskatchewan government is more so going down the route of they want monoclonal antibody therapy. That's something that they are pushing for to the federal government. The federal government has approved some of these treatments, and this treatment has been used most famously on former President Donald Trump when he had coronavirus, and at that time he had to get special approval from the FDA to use that. So I think that the provincial government here is pushing for these treatments here in Saskatchewan because they can reduce people's stay at hospitalizations. The issue is that this treatment is very expensive. We don't know how much treatments the federal government has. They've stated in a National Post article from a few weeks ago that they still are determining where they're going to be sending these treatments, who's going to get them, and I think the other issue is that when someone needs this type of treatment, the window's finite. So when we're at a state where we are starting to triage people, we got to know if a person is even available for this drug, will they get it? And I'm hoping that the provincial government can offer some more information about what the process would be like if they want to use a monoclonal antibody therapy here in the province.
Thank you for saying monoclonal antibody therapy, because I couldn't remember the term when I asked the question. Arthur, I don't get the disconnect. I truly don't. On one hand, you have a situation where the provincial government and the federal government don't seem to even agree where the problem may or may not be in Saskatchewan. From my understanding, what we heard last week from the Premier, the focus has been on the North and other communities. We know that's a problem in certain communities in the North. We know that certain communities in the North are doing better than others. But overall, there is a big problem in the North. I think we all accept that. Overall, we probably accept there's a big problem in the inner cities and urban Saskatchewan. What isn't getting talked about is low vaccination rates in the southeast, southwest of this province, particularly people under 40. Can you address that in just even broad terms? Because I have to ask you that because we don't know much information. The government doesn't give out much information on that particular issue. But what is the issue in relation to who is getting sick, at least with the limited amount of information that we have right now from the provincial government? Can we paint a better picture of what ICUs are looking like? And maybe can you address why we aren't talking about low vaccination rates and maybe ICU cases coming from southern Saskatchewan? It all seems to be talking about the North. Why is this? What's happening in that area?
Yeah, you're right that we don't have incredibly robust data on this, Murray. We do have vaccination totals, though, for first and second doses by region. So the regions are quite broadly defined. We have Southeast, Southwest, Central West, Central East, North, Regina, Saskatoon. And throughout, Regina and also Saskatoon, the largest cities, have been doing relatively well, comparatively well in their vaccination efforts. The province has tried to make more of a targeted approach in some areas, but when the Premier called out the federal government, he said, for not providing enough support in northern Saskatchewan, that a lot of people, I think, were dismayed to see him focus on only one particular region, when this really is something that is common to a lot of rural and remote areas across the province. That being said, in terms of ICU pressures, well, that's hard to track because we know where the ICU patients are. They're predominantly in Saskatoon, to a somewhat lesser extent here in Regina. but they're coming from all over the province. That's where people are being taken because that's where the resources are. And again, the ICU capacity is really reaching a limit in those centers with 65 people province-wide, more than at any other time during the pandemic.
Mickey, I'm throwing this at you because what's happening right now, honestly, is things are actually developing as we speak right now. And in terms of sort of the ICU cases, the government, or it was at least reported that the government was having 6 districts that didn't have any ICU capacity. Now, my understanding of that, just to clarify for people, and I hope you can, tell me if I'm right about this, or if you don't know, perhaps we'll explore it later, but is it my understanding that the districts that they're talking about are districts that never really had ICU capacity? And what is the ICU capacity in the major cities where people usually wind up when they have these serious issues, whether it's COVID or otherwise anyway?
Yeah, there were 6 regions where they had mentioned that there isn't ICU beds. It wasn't clear when they first posted that on the government website, when they said that these 6 regions didn't have ICU beds. But yeah, they never had ICU beds to begin with pre-pandemic. The capacity of ICU beds in the province are 79. But it's important to note that the province is surging capacity right now. And if we enter stage 2 of our triage plan, that's when we're surging ICU capacity by 150%, which is around 119 people in the ICU. And last week we were nearing 90. So things are, progressing in the wrong direction, is what I'm told from doctors who believe that we have not reached our peak yet. And this has been a difficult time for many in the healthcare sector right now. It's hard for me as a journalist to sometimes speak with these people, because it's at a point where almost every interview I do, someone starts crying on the phone.
Oh dear. Yeah, people don't get that. That's the tough part of our jobs. The really tough part in terms of this whole thing, it is isolated to individual families, individual people. The message from Dr. Wong, the tweet and the video that he put out about a young dad basically dying and apologizing profusely to his wife that, I'm sorry, I didn't get the vaccine when July 11th rolled around. I didn't think it was needed. Was one of the more compelling stories I think I've seen since the start of this whole miserable mess that we call COVID-19. Arthur, maybe I'll ask you this. Why is this not registering, with a lot of people, and why is the Premier in particular talking about something else? We haven't heard from the Health Minister very often. I think we are hearing from him today. But I don't understand fully why, if you look at the Premier's Twitter feed, it's about sort of pasture options for cattle or whatever else is going on politically. I get that he can put on his Twitter feed whatever he wants. But even putting out on his Facebook feed that he's out combining has got a lot of people really mad in this province that he and Health Minister Merriman aren't buckling down and dealing with that issue. At the same time, he's getting a lot of support actually from, I think, what would largely be described as people that are from rural Saskatchewan or followers. They're basically saying, look, he should be out doing other things and giving us a bit of a break from COVID right now. Is there a sense right now that we're that divided as a province? And I guess maybe why would the Premier not more often in particular, and the Health Minister, be talking about the crisis and everything that Mickey's talking about, these incredibly sad realities that doctors are dealing with and we all have to deal with?
Yeah, I think it's fair to say that for many, if not most people, COVID is pretty much the overarching, if not the only political issue that matters right now in the province, given the severity of this 4th wave and the stress that it's putting on the health system. So it doesn't seem like good politics to me to be trying to distract attention from that through anything from a combining post, like you said, to playing up other recent appointments that have been made.
Firearms thing.
Yeah. Right. So I'm not sure that that's going to work as a distraction, because the crisis is just so obvious to anyone that's paying attention right now. That being said, I think there's also a sizable proportion of the population that is tuning this out, that is completely fatigued by the extent to which we've been talking about COVID for the past almost 2 years now. Obviously, those may be some of the people that were leaving those positive comments on the Premier's Facebook post. I'm sure that he still has a lot of support within his own party. But we talked about some recent polls that have come out recently that show that there might be some shifts. There's a larger amount of people that are dissatisfied with the government's handling of the pandemic than has been the case before. So it seems maybe that they're trying to run away from that by not being as accessible to us, by not being as accessible to the public as they were when they were doing daily news conferences. I'm not sure that that's going to work.
Mickey, we're all pressed from time here because we're actually doing this while covering the recent developments and other things. So maybe we'll end with you. And I think it's a good place to end because you work for a national news gathering agency and you might offer a perspective on this that people here don't get. Are we different in Saskatchewan in terms of how we are reacting to COVID? Because I can't help but think if there were equivalent numbers in Ontario where there were 6,000 people a day getting sick, or 7,000 people a day getting sick, which would be the equivalent number, people would be very, very angry. Even in Alberta, I'm sensing a bit of a different reaction. Is there a sense from the media, from colleagues elsewhere, from even what you have observed, that maybe Saskatchewan does see this COVID is a little bit differently? Like Arthur said, I think people are just generally fatigued and would dearly love to be talking about something else.
Well, just from people that I have talked to, and obviously covering the pandemic since March of 2020 last year, and seeing how others have been responding to this, I think it's kind of a Western world morality issue where people don't necessarily believe in lockdowns in favor of the economy and learning how to live with COVID. We've seen that message not only pushed here in Saskatchewan, we've seen it in Alberta, and we've also seen it in many parts of the United States, where this is something that maybe we're not seeing in other countries in Europe or Asia who have taken a different approach, where they do favor, these short circuit breaker lockdowns. I think that, Premier Scott Moe, he had said that he is not ruling out any restrictions. The health minister is speaking today for the first time in 36 days. He's making himself available to media in a press conference type forum. So hopefully, maybe we'll be finding out if there's more restrictions. Maybe we won't. But I think that, Saskatchewan is not unique in the approach that it is taking. We have seen it in other places in North America, and I guess that's where I'll let it stand.
Well, absolutely, and I'm sorry we don't have more time to talk about the day. My fault. I was a little slow getting on this this podcast this morning, but I realize that you two have to fly. I am very going to be fascinated to hear the tone of government today, and whether there is going to be some recognition, something different than I think we heard from Scott Moe recently, which was anything less than apologetic about this, more explanatory than apologetic. The numbers have only increased then. And I guess we'll see this afternoon when we get more information on the situation. Arthur, Mickey, thanks so much. Mickey, thanks for joining us. You did a great job. Arthur, you did a great job as usual. And we'll see you next time on Inside the Marble Palace.
Thanks for having us, Ryan.
Bye.